Hey, I'm Dr. Cathy Barnett. I'm a veterinarian in North Carolina. I've been practicing here for 13 years now, since graduating from the University of Florida Vet School in 2006. Go Gators! And so living here in North Carolina and practicing here for the last 13 years, I see a lot of dogs with allergies. Unfortunately, North Carolina, it seems like, is basically the allergy capital of the world. I never really had allergies until I moved here, and I see people every day who say, hey, doc, my dog never had allergy issues, but now I moved to North Carolina and my dog's miserable. What's up? So I answer a lot of allergy questions every day, and hopefully I can answer a few of your allergy questions here in the next couple of minutes. So first thing that I always tell people when they have a dog with allergies is that allergies are managed and not cured. Unfortunately, that's the case. I'm sorry. I wish I had better news, but realistically, we can't fix allergies. So I have allergies myself. They tend to act up this time of year. I know that from here on out, I will probably always need medication this time of year to help keep me comfortable. Our dogs are the same way. You're probably always going to have to do something to manage your dog's allergies. There's no shot or medicine or something like that that's going to completely fix it. So now that we got that out of the way, there are three main causes of allergies in dogs. The first one is flea allergies. Second one is food allergies. And the third one is atopy or environmental allergies. So flea allergies, let's cover that first. Some dogs are really sensitive to flea bites. Those dogs are actually allergic to a protein in the flea's saliva. So even just getting a couple of bites from a flea can be all that it takes to completely send them over the edge with itching. So first thing you want to do is make sure that's not what's going on in your dog. Make sure that your dog is on a good flea prevention. And I don't mean like something really cheap that you picked up over the counter. Ask your vet, find out what works in your area, and make sure that your dog is consistently getting that prevention every month or every 3 months or whatever that's labeled for. If you do that and your dog is still itchy, even after months of good flea control, then okay, it's probably not flea allergies. So then you've got it narrowed down to either food or environmental allergies. The only way to definitively rule out food allergies is to do a food trial. And so what that means is feeding your dog a prescription, highly restricted food for a period of about 12 weeks. If your dog's skin gets better during that time, then that suggests, okay, probably there was something in the food that it was reacting to. If your dog's skin doesn't get better, then probably the food isn't the answer. A lot of people think that their dog has food allergies, but realistically, food allergies are actually less common than the third type of allergy, which is environmental allergies. So environmental allergies in dogs are basically allergies to all the things that you or I would be allergic to. Tree pollens, grasses, weeds, all those things that give us the runny nose, the watery eyes, they give dogs itchy skin. And so when they are exposed to those things, usually during certain times of the year, those dogs flare up. Now, there's a lot of things that your vet can do to help you manage those. There are prescription medications that can be used. They can do allergy testing and give your dog allergy shots to try to desensitize them to those allergens. All of those are great options. If you want something that you can try at home, there are a couple of things. So first thing is to bathe your dog really well on a regular basis. Don't do it more than once a week, but try to get some of those allergens off your dog's coat. Even take like a wet washcloth and wipe your dog's feet down when you come in from walking outside. Just by cutting down on how much of that pollen and grasses and all that they're bringing inside, it can cut down on how much exposure they're getting to those allergens. Another thing that you can try at home that can sometimes be beneficial is things like fatty acids and fish oils. So there have been some studies that have shown that those substances actually help the skin do a better job of keeping allergens out and can help minimize signs of allergies. If you try all of those things though, and your dog still isn't showing any signs of improvement, then I would definitely suggest talking to your vet. A lot of dogs ultimately will need prescription medication and other interventions to control their allergies. Hopefully you can head it off before it gets to that point, but if not, talk to your vet. I'm sure they've got plenty of tools to help.